Welcome to part 3 of our OCD series. Before we dive in, make sure to check out part 1 and 2 for a better understanding. The links are in the description. We hope you're enjoying the content so far. Let's get started. Did you know that over 2% of the world's population struggles with obsessive-compulsive disorder, OCD? That's millions of people dealing with constant, intrusive thoughts and compulsive behaviors like checking, counting, or cleaning just to ease their anxiety. But OCD isn't just about being overly organized, it's a serious mental health condition that can take over someone's life. The good news? OCD is treatable, and many people find relief through therapy and support, helping them break the cycle and regain control. In this video, we'll dive into what OCD really is and explore the path to recovery. Let's get started. Hoarding disorder. There is inconsistent evidence for the role of medications, particularly SSRIs, in the treatment of hoarding. In general, for people who do respond, the responses to SSRIs are poorer than those with OCD alone. The current approach is to attempt a trial of SSRIs or CBT, which can be helpful for hoarding. Compulsive skin picking. Similar to other OCD-related disorders, SSRIs may be helpful for compulsive skin picking but with limited effects. N-acetylcysteine and naltrexone have more robust effects, though habit reversal training remains the main treatment with such individuals. Trichotillomania. Except for clomipramine, which has shown some proven benefit in studies, SRIs are generally ineffective for trichotillomania. Alternatively, antipsychotics such as those described above may be beneficial as primary medications for trichotillomania. Studies have also shown promising results for N-acetylcysteine and naltrexone. The main treatment for this condition is a specific type of CBT called habit reversal training. Body dysmorphic disorder. Symptoms of body dysmorphic disorder are generally more responsive to SRIs, including SSRIs and clomipramine, with a potential role for augmentation with antipsychotics. How does OCD affect family and friends? Before we go ahead, make sure to like this video, subscribe to our channel, and hit the bell icon for more interesting and educational content. We do not live in a vacuum. We are surrounded by others who we have an effect on and who affect us. And the more we care about one another, the greater the effect. This might be especially true for people dealing with symptoms of OCD because they are woven through so much of life. All of the worries and repetitive behaviors that are a part of this disorder get played out within relationships and family life. People with OCD carry around severe and persistent worries in the form of disturbing thoughts, and once they have the thoughts, they will try to do whatever they can to get rid of them. The anxiety feels intolerable. This leads to repetitive behaviors in the form of rituals that they hope will undo whatever has made them so fearful. The misplaced logic is clear to partner, family and friends, but they also clearly see their loved ones' distress, and so they accommodate. Thoughts for loved ones. Gail's daughter always wanted a puppy, but Gail's fears of contamination made that impossible. At the end of CBT treatment, Gail was excited to tell her therapist that she had finally bought a puppy for her daughter. When your loved one is first diagnosed, you may find that a door has opened and hope arrives along with the possibility of treatment. You may feel that you have been trying to manage this on your own, trying to figure out how to provide support without the niggling fear that you might be making things worse. You may worry that the health professionals might judge you or not appreciate how much stress you have been living with. These are normal worries. Accompanying your relative to one or more visits to the doctor or therapist may be helpful. You can ask for family to be included so that you can be supportive of the care being provided. The challenge of dealing with accommodating, rituals and reassurance seeking. One of the biggest challenges of OCD is the many ways it affects relationships within the family. People struggling with the symptoms of OCD often doubt many of the aspects of daily life that others sail through. For this reason, they frequently look to the people closest to them for help in reducing their anxiety. At first, it just makes sense to provide reassurance. Yes, you turned off the kitchen stove. But as it grows to include other things or in intensity, family members may become irritable. Yet, as a family member, you may find that family life will slow to a crawl if you do not do things the way the person with OCD demands, by providing reassurance or participating in rituals. You may find yourself resisting these things sometimes and getting drawn in at others. You may experience guilt about how you are reacting at any given time and wish that there was a rule book to guide your actions. Loved ones may notice that family life can narrow down to their relatives' obsessions, rituals, and their own accompanying accommodations. A family life that has becomes preoccupied with one person's difficulties is not satisfactory for anyone. Even though it may seem that your loved one is suffering so much that it would be selfish for you to take your attention away, the narrowing of focus can create its own problems. Some research even suggests that members of a family dealing with OCD are under as much stress as the person who is diagnosed. Taking care of yourself is not selfish but can go a long way to supporting the solutions. Think of a mobile, a work of art made up of several interconnected parts. As suggested at the beginning of this section, when you take care of yourself, your stress is reduced and has a positive effect on everyone in your family. Do you know about 3 common myths and facts? Let me tell you. Myth number 1, OCD is just about being neat and organized. Fact, OCD involves intrusive, unwanted thoughts, obsessions, and repetitive behaviors, compulsions, that go beyond cleanliness or orderliness. It can affect any aspect of a person's life, not just tidiness. Myth number 2, people with OCD can just stop their compulsions if they try hard enough. Fact, OCD is a mental health disorder, and simply stopping compulsions is not a matter of willpower. It often requires professional treatment, such as therapy or medication, to effectively manage symptoms. Myth number 3, everyone has a little OCD. Fact, while many people have habits or preferences, OCD is a serious, clinically diagnosed condition that causes significant distress and impairment. It goes far beyond normal quirks or behaviors. Importance of taking care of yourself. Here are 8 well-researched stress reduction strategies. Number 1, recognize when you are feeling stressed. Some signs are increased heart rate and blood pressure, change in sleep patterns, difficulty concentrating, worry, irritability. You may even find that your mood is affected and you feel anxious yourself. Number 2, mindfulness meditation. Join a mindfulness-based stress reduction (MBSR) group to help manage stress with a daily meditation practice. They usually meet for 8 sessions and help you learn and start developing the habit of practicing mindfulness meditation every day, which has been shown to help people manage stress. Number 3, exercise. All forms of exercise have been shown to reduce symptoms of stress, including walking, running, aerobic exercise, yoga, tai chi, qigong, and pilates. Recent research also suggests that exercise may be directly beneficial at reducing OCD symptoms. Number 4, emotional support. Having the opportunity to talk with a non-judgmental friend or family member is important when stressed. Joining a family support and education group can also be helpful to gain perspective. Number 5, nature. Research has shown that taking time to be in nature reduces stress. Even a short walk can be helpful. Number 6, no one is perfect. This may seem obvious, but when there is suffering in a family, you can lose perspective and feel that you should not take a break until everyone else is okay. Number 7, scheduling in time for activities that you enjoy. Often when individuals are trying to support a loved one with a problem like OCD, they may forget to keep up their own interests and pleasurable activities. Number 8, professional counselors. Professional support, whether in the form of individual, couple, or family counseling, can at times be the best help for dealing with stress. If you or someone else in your family is depressed, anxious, or having thoughts of harming his or herself or others, this is the time to reach out to a professional. Congratulations! You have covered 8 well-researched stress reduction strategies. Talking to kids about OCD can be tough, but it's key to help them understand it's not their fault. With the right support, children can thrive, even during challenging times. Let's understand in detail. When a parent has OCD, we often hope that the children are going about their busy lives without being affected. Because it can be difficult to talk to a child about adult problems, parents may wish to avoid the topic entirely. But children are observant and almost always aware when there are difficulties in the family. And because children have limited life experience, they are likely to see everything through the lens of themselves. Parents are often unaware when children blame themselves for their parents' problems. This need to help them put things in perspective means that it is especially important to have a conversation about OCD, with an emphasis on it not being the child's fault. Here are some suggestions for helping children make sense of OCD in the family. Number 1. Provide information about OCD, its causes and treatments, using age-appropriate language. In general, as children grow, they will be able to understand and process more information. Young children will mostly need to understand that problems are being addressed by their parents. Number 2. Give them reassurance that they did not cause it and are not responsible for fixing their parents' problems. Number 3. It is also important to let them know that their parents' problem is being treated effectively. Number 4. It's especially important for kids to know that their parent has a problem but that it does not interfere with his or her love for them. Number 5. As much as possible, provide unstressed time with the parent who is not suffering from symptoms of OCD. This can help them keep things in perspective. Number 6. Keep their lives going along as normally as possible. School activities, sports and social events can help keep them connected even during difficult times. Number 7. As the parent with OCD improves, it is important for him or her to reinforce their relationship with the child. This will also provide stability, hope and optimism for facing the problems that will need to be faced in life. Number 8. Children are resilient. Everyone faces difficult times in life, including children, and we often gain confidence in our ability to handle the challenges of life when we get some practice as a child. Let them know that they are important and valued family members. Also, spending time with trusted adults, such as grandparents, aunts and uncles, can help children maintain confidence that things will be all right. Some suggestions for managing the challenges of recovery. Learn about the symptoms and treatments for OCD. As the old saying goes, forewarned is forearmed. The more you understand OCD as a treatable condition, the better able you will be to manage difficulties as they arise. When working with your clinician, become an expert about your treatment plan. Combinations of treatments can take up a lot of energy and time. Pay attention to the times when it may feel like it is just too much. This information is as important as the times when it all feels good. It can give you clues for when a relapse may be approaching. When working with your clinician, become an expert about your treatment plan. Combinations of treatments can take up a lot of energy and time. Pay attention to the times when it may feel like it is just too much. This information is as important as the times when it all feels good. It can give you clues for when a relapse may be approaching. Predict relapse. Practice how you can deal with stressful times and situations. Include the people who care about you in the planning. You might ask them to tell you if they notice that things seem to be more difficult. If those who care about you have been accommodating OCD symptoms, they may need to express their thoughts and feelings about the changes that are taking place. Sometimes OCD takes over family life to such an extent that life feels completely topsy-turvy when changes begin to happen, even good changes. Now let's learn about self-care for now and the rest of your life. There is a lot of information available these days about the importance of nutrition, sleep and work-life balance. For that reason, it might feel like you could skip this section. Or, you might feel that you are already doing so much with your treatment plan that you should just postpone these things until you have completed everything else. Additionally, people sometimes feel that their OCD has taken up so much attention from everyone else in the family that they don't deserve to be doing all these self-centered things. The fact is that one is more apt to relapse when they are depriving themselves of basic needs for good health. And it is just that word, deprive, that holds the clues to why this is so. When we feel deprived, every step in treatment is likely to feel like a burden and not like the steps toward freedom that it actually is. Here are some practical suggestions for taking care of yourself as a part of your plan to minimize relapse. The basics should not be overlooked. Taking care of your body with a healthy diet and fluids is important for having the energy to follow through on your treatment plan and for overall health. You may have been so focused on dealing with your anxiety that you have lost sight of the basics. If you are not sure about diet, ask your clinician for a referral to a nutritionist. Having someone who is a specialist on your side can help you to develop and maintain healthy habits. The basics should not be overlooked. Taking care of your body with a healthy diet and fluids is important for having the energy to follow through on your treatment plan and for overall health. You may have been so focused on dealing with your anxiety that you have lost sight of the basics. If you are not sure about diet, ask your clinician for a referral to a nutritionist. Having someone who is a specialist on your side can help you to develop and maintain healthy habits. Time. Taking time with family and friends, as well as time for yourself, will help you to remember why you are following through on a challenging treatment regime. And as OCD takes up less of your time, you will find that there is more time available for living. And that is the goal of all this work. Follow up with your therapist. Once you feel better, you might think that your therapist is the last person you would want to see. But continuing care can help you maintain your hard-won gains. Follow-up care also means that you will be able to address setbacks when they first show up, before you can slide back into old habits. Life plans. OCD can take up so much time and energy that it may be easy to forget the rest of your life. Remember that recovering from OCD means that you will have more time and energy to devote for developing and following through on life goals. Make plans for the future, for yourself and with those you love. Make those important plans that might not have seemed possible before you began your recovery journey.